I thought we should start a series on spaying and neutering with a look at how we got to this point where there seems to be so much confusion around the subject. As a starting point, I think we need to look at how we as veterinarians have been educated for essentially generations in what influenced historical recommendations around this subject. The unfortunate consequence is that many of these recommendations have been so ingrained into the profession that you will still see many clinics making blanket recommendations around spaying and neutering, such as all dogs at 4 to 6 months of age should be altered. I assure you that not one of those clinics is making those recommendations has any ill intent behind the recommendations, and that they still believe their recommendations are based on the best interest of your pet and your life with that pet. The truth is that in the last 10 and really the last 5 years, there has been a lot of new research to come out on the subject, and these historic recommendations are taking way too long to fall by the wayside. There are really 4 major categories that influence the recommendations to spay and neuter dogs, and particularly with early spay and neuter. They are pet overpopulation, the elimination of behavioral issues, decreasing the risk of serious medical conditions, and an owner desired to not have an intact animal in the home. As someone who has had all females and only one male, I can attest that having an intact female in the house is a pain in the butt. The first of these we're going to tackle is to prevent contribution to pet overpopulation, with the resulting strays and an increase in dogs in shelters and humane societies. You didn't even have to go to vet school to get that notice. For 35 years, Bob Barker hosted The Price is Right and ended every episode with, "Help to control the pet population. Have your pet spayed or neutered." I haven't watched the show in decades, but I understand that Drew Carey has continued this plea. The idea behind this thinking makes sense. A neutered or a spayed dog is certainly not going to contribute to the issue with pet overpopulation. The problem with the logic is that typically it is not responsible pet owners that are contributing to this issue. I've seen references that only 5% of shelter dogs are purebreds, and if you take pit bulls and chihuahuas out of the equation, it drops to just 3.3%. I will say that even in my own practice, I have had responsible breeders and owners who end up with an oops litter. And I know of several of these that weren't a purebred combination. But to a person, all those pups were all placed in good homes, often with more scrutiny than had it been a planned litter, and in the case where the homes didn't work out, they were welcomed back to the breeder and either rehomed or kept as new additions to the pack. I'm guessing that any of you taking the time to watch this video probably care enough about dogs that the idea of a perfectly healthy dog being euthanized in a shelter causes a great degree of sadness. The problem, as I see it though, is being caused by people that either don't care to this degree and or don't have the resources to seek adequate veterinary care. I would suspect that if we spayed and neutered virtually every dog that sought out routine veterinary care, we still wouldn't make a dent in the overpopulation issue because we aren't targeting our efforts at the correct dogs and dog owners. This becomes even more problematic for those of us with purpose-bred dogs. It might sound like a fanciful idea that we all could just stop buying purebreds and adopt from the endless supply of shelter dogs. The reality is that while many of those dogs may make wonderful companions, there are very, very few that will be retrieving late season mallards or pinning a covey of grouse out on the prairies. And while it might seem noble to advocate for spaying and neutering to help control the pet population, that argument just doesn't carry the weight it once did with how responsible dog owners care for and house their dogs these days. Next up on the list of historic reasons to spay and neuter is the elimination of problematic behaviors like aggression, wandering, and mounting. I think all of the canine behavior textbooks that I own usually contain spay or neuter as the top recommendation for nearly every canine behavior problem. To the credit of many of them, it was often stated that testosterone wasn't necessarily the root cause of many of the issues, but rather that testosterone caused many of the reactions to be quicker or more intense with these negative behaviors. Here again, this train of thought seems logical, and for most of my career, I believed in this logic and promoted it to many clients and believed it myself. As it relates to male dogs specifically, this is typically directed towards inner male aggression, marking, and mounting behaviors. I'll confess, it was the same logic that I used when I made the decision to neuter Boomer later in life. He had started marking more and wouldn't tolerate my hunting buddy's male dog if the dog got overly rambunctious. When we look at the studies though, we now know that when neutering is performed After 6 months of age, it proves to be completely ineffective. Now, this is a statistical thing, and it doesn't mean there aren't cases that it would have an effect, but in general, it is not effective. Ironically, I felt like with Boomer, the areas I had concerns with improved. Now I question if I had a little selection bias action going on and that I actually was aware of the behaviors and changed my interactions with him and they were corrected via training rather than the neutering. When we take a look at the pros and cons of spaying and neutering in future videos, we will talk about some studies that have actually shown a negative behavior change with these procedures in some breeds. The third major category that we have trumpeted as a profession is that spaying and neutering will decrease the chances of serious medical conditions. Particularly, we focus on things like Spay-Neuter, which is when the uterus fills with pus, and mammary cancer for female dogs, and testicular and prostate diseases as it relates to male dogs. In our previous video on the subject, we looked into the impact on male dogs and our understanding that neutering is associated with an increased risk of prostate cancer. With females, when we take a look at the two major health issues, Spay-Neuter and mammary tumors, we need to offer some clarification. First, on the Spay-Neuter front, this is absolutely a real issue and something that needs to be discussed if you are planning to keep your female intact. A spayed female will have nearly a 0% chance of having this condition. I say nearly 0% chance because I'm old enough to have seen some odd situations involving remnant ovarian tissue and a small amount of uterus left behind after a spay. With an intact female, the risk of having a Spay-Neuter is in that 20 to 50% range. The female dog is unique in that her body thinks it is pregnant every time it goes through a heat cycle. This is why they experience false pregnancies. What happens over time is that each time she goes through one of these cycles, but isn't bred, the environment of the uterus changes. It is designed to incubate and grow the puppies, and if bacteria end up in that environment, it can act as an incubator for them as well. There are times that the uterus will come out during surgery containing several pounds of pus. My first dog, Emma, still has one of the largest uteruses that I've ever seen come out at surgery. All of my girls have ended up spayed, admittedly later in life, and primarily due to the increased risk of this condition as they age. On the mammary cancer front, for years we have talked about the benefits of spaying before a first heat and decreasing the risk of mammary cancers. This recommendation is based on a journal article from 1969, and how the information is presented over the years has become somewhat skewed. For as long as I can remember, which was a long time ago as I started my vet career back in the late 1900s, the numbers used based on that one study were that if we spayed a dog prior to their first heat, she had a 0.5% risk of developing mammary cancer. Prior to the second, it was 8%, and after the second, it was 26%. What the study actually references with that percent risk is that it is the percent risk of that of an intact animal, not its overall risk. Meaning that if the overall risk for an intact animal is, let's say, 10%, then the risk after that second heat is 2.6%, not the 26% risk that we as veterinarians have been promoting for generations, basically since 1969. Subsequent studies, some out of Europe where spaying and neutering aren't as widely promoted, have called into question the actual risk of these mammary tumors. The other thing that has come to light, and we will discuss in subsequent videos, is the increased risk of certain cancers in certain breeds as it relates to spaying and neutering. I have had several of my own females have mammary cancer over the course of their life. Belle had a total of 7 or 8 surgeries around malignant mammary tumors and lived to 16 and a half years old and didn't die from cancer. Most recently, V had a mammary tumor removed that was thankfully benign. Compare that to diseases like hemangiosarcoma, osteosarcoma, and lymphoma that we see an increased risk for in associating with spaying and neutering in some breeds, and it should cause all of us to step back and have a conversation about recommendations going forward. I'll take a moment to stress here, and several times in upcoming videos, not all breeds show the same increased risk for cancer, and this certainly is not the end-all blanket statement that you shouldn't spay or neuter. I'm intending this series to provide all the available information to allow people to make informed decisions on current information. In the upcoming videos, we will also cover topics like increases in non-cancerous issues like joint disorders, as well as the overall effect on lifespan. The important point to take home is that a lot of this is new science and information that has only come out in the last 5 years. There is going to be a lag between this information coming out and changing the discussion in the profession with ingrained behaviors that have been in place for generations. Don't mistake that for me giving the profession a pass on this subject. There are things I learned in putting together this series that have changed my knowledge and recommendations going forward. I had always poo-pooed the idea of an ovary-sparing spay, but now understand that in a few select breeds, that may be the best option for the case for longevity. The last category is general owner preference against having an intact animal in the house. This category is kind of self-explanatory and I don't think needs extensive discussion. With male dogs, this usually centers around marking, aggression, and hypersexuality. Intact female dogs typically cycle 2 times a year and can have bleeding and discharge for nearly a month each cycle, which I can attest is problematic to deal with. While this point is pretty straightforward, I also think it is one of the most individualized parts of this discussion and one that internet experts don't always take into account when giving their recommendations. As I was preparing this series, I came across content from Dr. Bruce Christensen of Kokopelli Veterinary Center. You can look him up at their website, kokopellivet.net, or on Instagram at kokopellidvm. If you are serious about breeding or just want to learn more on this subject, I would highly encourage you give their content a follow. They also have some on-demand webinars available at their site. I've not watched any of the webinars, but the one continuing education lecture I did see, I was very much blown away by Dr. Christensen's approach, knowledge, and his delivery. Next week, we'll take a deep dive into what we know about some of the long-term health effects of spaying and neutering with things like joint disorders, cancer, and lifespan. We will look at what we know about particular breeds in the areas we have more generalized knowledge.